Good morning, good afternoon, good evening, depending on where you are joining us from. Welcome to our webinar, Protecting All Advancing Universal HPV Vaccination in the Middle East and North Africa. I am Dr. Balkiss Abdelmoula, lead of the MENA Coalition for HPV Elimination Secretariat, and I will be your moderator today. So, before we start, a few housekeeping notes. Please use your chat by typing your name and organization. This will be an interactive webinar, so we will take your questions and input just after the speaker presentation. So make sure to take part, and we will have this webinar recorded, and we will share the recording afterwards. So we wanted to have this as a first initiative as part of the partnership that the MENA Coalition for HPV Elimination has with the new partner organizations Global Action on Men's Health, as well as NOMAN is an island race to end HPV. We recently joined forces to focus specifically on advancing universal HPV vaccination with a shared commitment to equitable access on HPV immunization for all, including men and boys. So today's webinar is to explore the progress, the remaining gaps, and the opportunities to accelerate universal HPV vaccination in the MENA region, and reinforcing equitable access to this essential preventive service while we are celebrating the Universal Health Coverage Day this week. So this is a brief overview of our agenda today. We will start with our presenters, guest speakers, and then we will take your questions and input, and we will share with you the recording afterwards. So without further ado, I'm happy to present our first speaker for today, Dr. Aarti Singh, Immunization Medical Officer at WHO EMRO. She brings over 24 years of experience in the field of epidemiology, vaccinology, and health system strengthening. She led major disease eradication and outbreak response programs at WHO, including polio, measles, rubella, COVID, and Ebola. Dr. Singh will provide us today with a regional overview of HPV immunization progress across the MENA countries. So without further ado, Dr. Singh, the floor is yours. Please unmute yourself, Dr. Aarti.
Thank you, Dr. Balkiss. Thank you, everyone. I hope you are able to see my screen.
Yeah, it's very clear.
Are you able to put it in presentation mode?
Yeah, yes. Is it okay?
Yeah, please go ahead.
Okay, thank you. Thank you very much. And good morning, good afternoon, and good evening, everyone. And a pleasure to be with all of you. Thank you to Dr. Balkiss and all the organizers who has given me this opportunity. I will take everyone around the overview of cervical cancer HPV vaccine introduction in Eastern Mediterranean region. So this is the flow of my this is the flow of my presentation. And so let's start. So unfortunately, one woman dies of cervical cancer every 2 minutes globally, and one woman per hour when it comes to EMRO. And though this is preventable, but it's very unfortunate over here. When we see the majority of HPV related cancers are cervical cancers, and it attributes to 85% of cancer cases with HPV. And however, EMRO is the least affected region, but then EMRO has recorded in 2020 EMRO has witnessed 19,000 new cases and 12,000 deaths, and 90% were linked to high-risk HPV, as the report says with this. So, however, EMRO has the least incidence as compared to other regions over here. And Eastern Mediterranean region cervical cancer strategy, it is aligned with the WHO global strategy of 90-70-90%. And the key pillars are 90% of primary prevention with the HPV vaccine introduction. The 70% is screening infrastructure and cost of HPV test. low awareness, and 90%, and the third one is access to radiotherapy and palliative, which comes under the umbrella of the management. So these are the three pillars with the global strategy, to which the EMRO has added health system strengthening and communication advocacy as a fourth and fifth pillar. HPV vaccine is the best buy to reduce the cases, and SDG 2030 agenda is to target target is 30% of reduction in mortality from cervical cancer. So around when we talk about the cervical cancer elimination strategy, it is very important to work across the units, particularly immunization as well as the non-communicable diseases, to address this issue and achieve the elimination strategy. Coming to the next slide, when we see the globally, countries with HPV vaccine in introduction into immunization program or into the health programs. So this is slide as of 10th of November, and where 81% out of 194 countries, 158 countries either have introduced HPV vaccine in routine immunization nationwide or partially, and they are on the way of scaling up. Like example, in our region is Pakistan, who has recently introduced and will scale up in in coming years with this. So when we talk about the cervical cancer incidence in EMRO region, we can see on the left-hand side of the screen is the countries. The blocks with the green blocks are already the countries who have introduced HPV vaccine into their routine immunization. And when it comes, like, out of 21 countries, 10 countries have introduced HPV vaccine in EMRO region. The elimination threshold for cervical cancer elimination is 4 per 100,000 cases. And you can see in the graph that only 3 countries are below the elimination threshold. Rest all of them are in our region are above elimination threshold, and Somalia is the highest. But here is an inequity, like all the high income countries, despite less threshold, but then still they have introduced with the available resources. But we can see in our region, Somalia is the country which has the highest threshold. But yeah, it's still yet to introduce. There are other basic vaccines. They are in introduction pipeline. And definitely, we are also advocating with Somalia to introduce the HPV vaccine. On the right-hand side, the graph, the map shows the countries with the who have already done the introduction, and those who are planned and not introduced. So planned, it is just a small dot where we can see Djibouti and Lebanon. Djibouti is going to introduce HPV in this month, maybe in a couple of days. And Lebanon is scheduled to introduce HPV vaccine mid next year. So this is the dashboard maintained by WHO HQ, where it gives you a clear-cut picture of, like, the cases and everything about about the status of the HPV vaccine introduction within the region. And here we can see like almost 43% of the countries out of 21, they have introduced HPV vaccine. 50% of the countries are only vaccinating females, and 50% countries are vaccinating both males and female, both the genders. And when we look at it, like the schedule of the HPV vaccine, like 63% are giving 2 doses, and only 25% are administering 1 dose. Especially all the Gavi countries are administering one dose, and rest all the high income countries are administering with the 2 dose. However, the WHO current recommendation says that the single dose is equally effective as 2 or more doses, and the vaccine efficacy with single dose or any dose, like irrespective of the doses, the vaccine efficacy is around 95%, which is very high. And the effectivity lasts for more than 10 years. even there are studies proven that more than 10 years, the antibodies are there with this. So HPV vaccine, this is the status of HPV vaccination in this in the region, where you can see all the countries have 2 or 3 doses. Only the upcoming Gavi eligible countries are administering 1 dose. That this slide also shows which platform is being utilized to administer the kits. So schools and schools as well as the private practitioners in the primary health centers, multiple platforms are being used, and some are systematic into the program, and some are the opportunistic vaccination strategy being used within the region. However, the key message from this slide is despite the 50% of countries have introduced HPV, but we have achieved only 3%, or we could only target the 3% of the targeted age group among women. So the vaccination coverage is very low despite 50% countries introduce HPV vaccine. So some of the lessons learned from this, I'm not going to read this slide. The 17 countries globally have conducted post-introduction evaluation following HPV vaccination. And the key factor came out is like poor microplanning, poor coordination, poor management, and inappropriate timing of vaccination, because it has to be aligned. When you are using the school-based strategy, it has to be aligned with the school school openings and other things. So the success factors are many, and we all are aware of that. But the important and the key message is poor microplanning, poor coordination, and poor management, and poor timings of vaccination. Some of the countries has mentioned that delays or shortages in funding or vaccine availability, but the product range has been scaled up, and the shortages are coming down, and Gavi is also making sure that HPV vaccine is available for the countries those who want to introduce with that. So coming to the challenges, basically these are the key challenges: awareness and acceptance, where misinformation or myth is one of the key factor. But anti-vax movement is also growing very progressively in many of the countries. The another challenge is safety concerns and hesitancy, cultural and gender sensitivities, consent and school delivery barriers, economic and operational constraints, because this vaccine is unique vaccine, is expensive vaccine as compared to other vaccine. And it is not only the introduction of the vaccine, but the thing comes is the sustainability of the vaccination program into the routine is challenging for many of the countries. So that is the economic burden on the Ministry of Health with that. Another thing is conflict and fragile countries. Majority of the countries in the EMRO region are conflict and fragile settings, and they are having insecurity problems, internally displacement issues, and other things are other challenges. There are programmatic challenges which can be very well overcome, like weak planning, underutilization, and lack of full-scale communication. Communication is the key for the HPV vaccine rollout, because our experience shows that wherever the communication strategies were not sustained or not full-scale implemented, they face challenges to bring up the coverages after introduction. And systematic issues are target setting, global vaccine shortage, and poor surveillance. So what EMRO supports to member states? Basically, this is my last slide. Like when any country want to introduce the HPV vaccine, they reach out to us for the technical support for evidence-based decision makings by NITAG, which recommends to the government, especially 1 dose versus 2 dose, only females or both the genders, selecting age cohort. This is all based on the epidemiology and other thing, and all the technical papers available at the WHO. We support the countries into this. The other areas of support includes developing Gavi application and submission. This is related to the Gavi eligible countries. The other areas are generating evidence through behavioral and social studies, social driver studies, CAP, and other studies. We support the member states for that. Preparedness assessment. When country is rolling out vaccine introduction, we support the member state in assessing the preparedness. Capacity, we support the countries for capacity building of health workers. During the introduction, rapid convenience monitoring, post-introduction evaluations. These are some of the areas where WHO EMRO office is supporting the member states with this. So this is all about, and the concluding remark, WHO 2030 targets to cervical cancer elimination strategy, call for introduction in all countries, HPV vaccine introduction in all countries, but we only could do by 2025, end of 2025, 50% countries have introduced that. EMRO is lagging behind, but now HPV vaccine is picking up since last 1 year. Single dose schedule can be used to achieve high coverages, and low coverage continue to be challenged for HPV programs globally. One dose can be strategy to expand protections. These are some of the, this is the dashboard maintained by WHO HQ, and you can reach out to this website and you can find all the related documents which you would like to refer and learn with that. So this is all from my side. Happy to answer the questions. I hope I maintained the time. The time was too short. Thank you.
Thank you so much, Dr. Singh. Actually, you are perfectly on time, and we're very lucky to have you present this comprehensive overview over the region. I know we call it MENA from our side, but it's from WHO side. It's the Eastern Mediterranean region. There's a few differences, but not much. Well, thank you so much once again. We will take the input and questions afterwards, after all presentations are made. So next, we will have our speaker from Qatar, Dr. Khaled Hamid Elawad. So Dr. Khaled is actually the health manager protection at Primary Healthcare Corporation in Qatar. He has over 25 years of international public health experience. He oversees infection prevention, communicable disease control, immunization, sterilization programs, etc. He also serves on national and international advisory committees, including WHO and the World Bank. And today, Dr. Elawad will share with us Qatar experience, actually pioneering experience in rolling out the HPV vaccine, as well as Qatar's plans towards universal HPV immunization. So the floor is yours, Dr. Khaled.
Thank you. Thank you very much. So good morning, good afternoon, and good evening for all our participants. And thank you for having me in this webinar. So today I will be speaking about Qatar experience in HPV vaccination. And before I do that, I just want to give an overview about the organization that I'm working. So I'm working the Primary Care Corporation here in Qatar. This is the main governmental provider of primary care service, which established in 2012. Before it was joining the secondary care, and now became mainly preventive and community-based health and wellness services. We have 31 health centers scattered all across Qatar, including 7 wellness centers. Obesity is a public health problem in Qatar, so this wellness center will provide physiotherapy, and also, we will provide physical activities where they have gyms, swimming pool, and even we have sauna in our health centers. Our services is mainly adopting the family medicine model, where we're providing the maternal and child care, preventive screening service, dental, mental, immunization, urgent care, home care, and wellness, as I mentioned. Next, please. So when we speak about HPV infection, there is a key component for successful HPV program. And this actually the framework that we used here in Qatar. So there was a strong stakeholder engagement. There was a national committee that had been formulated between Ministry of Health and different health facilities. And they met and they put the targets, and we adopted facility-based firstly as opportunistic, and then now it is adopted as a school-based program. Of course, we are monitoring. We have very good. We have one electronic medical system for the whole country for primary care and secondary care, and we are monitoring the vaccination rate very closely with the dashboard that we see in each place and which places need to be enhanced. One-stop vaccination, of course, as I said, we adopted the facility-based and the school-based, so we can give the community more access, specifically that we are targeting from 9 years to 45 years of age. And we manage to do a regular and sustainable community awareness campaign. Next, please. So the delivery, we had some strategies, and as I said, that we were thinking about it. The vaccine were introduced in Qatar first as a facility opportunistic base, and we managed like make an assessment between what is the benefit of school-based and facility-based, and you can see here clearly described that in the school bases allow many adolescents to be vaccinated, can help facilitate sensitization and mobilization of parents, community, may be used to identify those who are not in school. And for the facility, of course, it's reduce the transport and personal cost to the health system, can implement vaccination days, which we are adopting now, and also may collaborate with the school to bring adults into facility. So in Qatar, it's school-based and facility-based. Next, please. So this is here, I draw up the journey of HPV vaccination program in GCC. So the first country that introduced HPV was UAE in 2008, and it was only in Abu Dhabi. After that, and it was only for girls, and then they made it like a school-based program in 2019. And also it was only for girls, and they introduced the 9-valent HPV vaccine. In 2021, Saudi Arabia have adopted the quadrivalent vaccine, school-based, and it's only for girls. And then in 2023, it was ruled out as gender-neutral vaccine in UAE in 2023 as a school-based. And then in Qatar, as I said, firstly, we adopted like community-based gender-neutral program for 11 to 26 years with 9-valent HPV vaccination. We started as facility-based, opportunistic, and for this year, it's first year that we adopted as a school-based. As you all know, that the human papillomavirus infection poses significant public health issues for both men and women. A recent study have brought attention to substantial impact of HPV-linked cancer in men, despite historically focusing more on its effect on women. In 2019, it has been revealed that HPV was the root cause of approximately 70,000 cancer cases in men. And this is why Qatar adopted that it will be straight away, if it's school-based, it will be gender neutral. Even in the when it was facility-based, it was gender neutral. And then Kuwait in 2023 adopted as school community-based gender-neutral vaccine. And then also in the same time was Bahrain. And lastly, now there is a plan for Oman. I think Oman, they will start soon. So you will see that UAE, Saudi Arabia, and Bahrain have implemented school-based, and Kuwait and Qatar introduced HPV vaccine as community-based program, and Oman in its way. Next, please. I just hear this describe the governance of vaccine here in Qatar, and we have INTAG, and usually there are the consultant committee for the Ministry of Public Health. So, and usually they give the recommendation after they do all the scientific study, including disease burden, vaccine match, efficacy, cost effectiveness, safety, and also make a recommendation for the vaccine, and also we will have with it the political empowerment inside it. And the vaccine usually will be distributed in the primary care centers and also in the private vaccine clinics, which we are providing these private vaccine clinics for free. So usually the vaccine all will be centralized, purchased, and then will be distributed even for the private for free. Next, please. This is a study for physician knowledge and attitude in Qatar. And a recent cross-section study among 557 physicians in Qatar found that 83% has sufficient knowledge about HPV infection and vaccination. However, 69% from them a new HPV vaccine were available in Qatar. This study was in the beginning when the vaccine was introduced, and 77% believe the vaccine significantly reduced HPV-related cancer. We had some barriers. Lack of awareness was 61%. Doubt about efficacy and safety was 26%. Fear of promoting risky sexual behavior. This was, as you know, that this a little bit was people were thinking about it when we did the study, that it's culturally not acceptable, but we managed to relate the vaccine to the cancer and not for the STD only. And also there is a university student knowledge and vaccine uptake. And the study showed for the 398 students in education city that 22 had poor knowledge and 55 had some awareness and 22 had a good knowledge about the HPV infection. 71 of the unvaccinated students were willing to get the vaccine and if recommended by healthcare provider. And that's why we've done a lot of community awareness in the universities and in schools even, so they can take the information back to their families and making sure that we get better coverage for vaccine. There is a key practice gap despite strong physician knowledge, hesitancy and cultural barriers remain significant. Community misconception, including HPV linked to risky behavior, and low perceived risk of HPV infection, limited discussion of sexual health in clinic setting, reduced vaccine advocacy. Next, please. As I said, here in Qatar, where we straight away we use Gardasil 9 and in girls, women, and boys. And we use it from 9, the guideline. We had a national guideline that is recommended from 9 to 45 years of age, although right now we are speaking that there will not be an upper limit. And here about the Gardasil and the content of Gardasil and the types that making the cancer is 16, 18, 31, 33, 45, and 52, and 58. And for the genital warts, we know that 6 and 11 are the main cause of genital warts. Cervical cancer screening currently is adopted here in Qatar, but it's still opportunistic. It's not a core recall, and we are aiming that it will be soon. It will be a core recall. We always explain that we don't know the cause of cancer. We don't know the causes of many cancers, but there is a direct causation between HPV infection and cervical cancer, and recently pharyngeal cancer in men. And this was the decision to introduce the 9-valent vaccine. Next, please. So this is some strategies that also we implemented to make sure that to encourage HPV vaccination. So raise HPV risk perception by naming specific diseases, cervical cancer, or pharyngeal cancer, tongue cancer, anal cancer, perineal cancer. Integrate HPV vaccine messaging with cervical cancer screening when the women come for screening. And for in dental clinics also we spoke about oropharyngeal cancer, so people will be more aware about it. Discuss cancer prevention. Use simple language that assume vaccine delivery, and strong endorsement of HPV vaccination, and educate on most of the common side effects. And we know that the integrity of any immunization program will rely on good surveillance for adverse reaction for immunization. So we have a very strong surveillance for any adverse reaction for immunization, although we didn't see much of it. Next, please. So this is my last 2 slides. I hope that I have enough time. This was the training that we done for healthcare worker in Qatar with the support of Ministry of Public Health and Qatar Cancer Society. Yes, and I want to remind here that we also use non-governmental organization in our advocacy, so they can give some stories for women that they had cervical cancer, or any men that they had any problem related to HPV vaccination. So this was very helpful during. And lastly, to make sure that we minimize the hesitancy and making sure that our nurses are well equipped, we give them an additional training with the nursing university here in Qatar about vaccine, about cold chain vaccine and administration of vaccine, which part of awareness in general for healthcare worker and the community, and making sure that we have a safe journey for school-based vaccination and in the facility-based. And thank you very much.
Thank you so much, Dr. Khaled. We're very pleased to have you with us today and to listen to the experience of Qatar regarding HPV vaccination. It's really inspiring to see the progress that has been made recently within just a few years. And now, without further ado, I'll move to our next speaker, Dr. Ibtihal Fadhil. Dr. Ibtihal Fadhil is the founder and chairwoman of the Eastern Mediterranean NCD Alliance and also the chairwoman of the MENA Coalition for HPV Elimination. So Dr. Fadhil will present for us today our coalition's advocacy efforts and outline the next steps to advance universal HPV vaccination in the MENA region. Without further ado, Dr. Ibtihal, the floor is yours.
Thank you very much, Balkiss, and thank you very much for all organizing committee and host, and also for all the participants who joined us today for this session. I'm very happy to be after the WHO and after the presentation from Qatar, all excellent presentation that set a scene and for the situation from the main sectors, that is the UN leading sector and also the Ministry of Health in one of the GCC country. So I'm talking here representing the civil society perspective and what we do in terms of the coalition of the civil society for the fight for the HPV elimination in line with WHO strategy. So let me start with, you know, I'm coming from two angles. So from the Non-Communicable Disease Alliance, which is also a network of civil society working in the area of all non-communicable disease, including cancer and definitely cervical cancer and main cancer, HPV-related cancer. And this is why we for the importance of the topic and for the lobby which happened before the WHO strategy created, that we had decided in the region to create this network that is the multi-sectoral platform to accelerate the HPV elimination in line with what Aarti has mentioned, the WHO strategy and the target 90-70-90. So we are, our alliance or our coalition composed of public health leaders, civil society, clinician, and people who advocate for HPV elimination, working in the area of Middle East and North Africa. And I should mention most of the time, because of the background of the NCD, we work also with the EMRO region, with all the Eastern Mediterranean region. So we currently, back to the slide, we currently have over 500 members in our network. We share always experience and we share our updated evidence related to the topic. And I'm also inviting everyone to visit us through the Twitter, Facebook, and also the NCD network. Next, please, Balkiss. What we do as a our strategic objective as a civil society network is to catalyze, in terms of the prevention, to catalyze the gender-neutral HPV or universal HPV vaccination uptakes. We want to strengthen the policy in line with WHO elimination targets, and also focusing on advancing research and data in the region, because I think the previous two speakers have also alluded to the topics of the importance of having data in place and generate data to convince policymaker and convince health professional and public. We focus also, one of the key elements, we do public awareness and increasing the momentum for advocacy related to HPV. I should stress that when we talk about HPV, I mean, as a coalition, we do the whole spectrum from prevention, screening, and treatment. But let's see, zoom into what we do in terms of the universal HPV vaccination. So I think just to go over again the regional progress, in addition to what Dr. Khaled previously mentioned, that most of all the 6-country GCC currently is introducing and have introduced the HPV part of the national immunization program with variation regarding, GNV vaccination and whether it is a school-based or community-based. But all of them have already introduced the vaccine. In addition to that, we have Libya, Morocco, Tunisia, and lately Pakistan. So we are very happy having 10 countries now in our region have introduced the HPV vaccination in their national program. In terms of the screening, we are struggling. There is a lot of limitation and challenges related to addressing the target 2 of the screening for cervical cancer. Next, please. What we do as HPV MENA, we focus on advocacy, and advocacy, as I mentioned, in line with the WHO strategies. I mentioned WHO strategy because we don't want to be fixed for the cervical cancer. We want to expand to HPV-related cancers that include main cancer. This is why we want to strengthen the advocacy with our partner, global partner, encouraging on strengthening the universal vaccination strategy. We do a lot of regional dialogues, and this is a regular activity where we invited and convening these meetings as a webinar or event in line with the global event to discuss progress in the region and to discuss challenges and priority and the way forward. The other activity is also in partnership with the global partner like IBVS and other global partners to raise awareness among the public, similarly health professionals related to the introduction of the vaccine. And this is a very key point, as mentioned by Dr. Khaled. These are campaigns. We have a campaign in March. That is the campaign in line with the IBVS campaign to support the perception, shift the perception of the public and health care providers. This is a key challenge in our region. That's the attitude, the myth, and the stigma surrounding HPV vaccination. We work as a coalition, but we want to strengthen our partnership with regional as well as a global partner to improve the uptake of the vaccine in our region and also focusing on the universal vaccination. Next, please. One of the key area we started with is the data generation and research, because most of the policymakers, even in the GCC country before the introduction of the vaccine, and I'm talking here mostly about Morocco, the case of Morocco, Tunisia, and even now we are the countries who are like Pakistan. All the policymakers, they need an investment case and they need data related to the HPV incidence, male and female, and also cancer-related data in the region. So this one created as a dashboard for the incidence and the profile by country for HPV and cervical cancer, and hopefully we will also create a sort of a country profile for male cancer, HPV-related cancer. So this is, I think, it's very key advocacy tool to support the national and the regional advocacy for implementation or introduction of the vaccine. We do regularly also capacity building for health system, and it's also including the area from a prevention, screening, and treatment as in line with what we needed for the country to adopt, to achieve the targets they are endorsed. I also part of our work, because we work in partnership. This is a complex and a very challenging agenda. And to address that agenda, you need multi-stakeholder, multi-partner working on it. And that is working in partnership with Ministry of Health. The case of like what's always happened during the year, we have a policy dialogue with the national focal point for immunization and Ministry of Health, and also including WHO, EMRO working with us on this agenda. And we are happy for this sort of continuous partnership and collaboration. We work with different civil society, youth organization, and advocacy group in the region. Similarly, we are very keen to work also with the private sector and the funder to strengthen the HPV vaccination in the region. So what is next? We want to scale up the country policy alignment and also improve the financing models. I'm underlying this issue because it might not be a big challenge in the GCC country, but financing the national immunization program for HPV is also a big challenge for a country like Pakistan. We really acknowledge their advocacy work and efforts in introduction of the vaccine with the support of Gavi, because it is a very challenging investment into HPV vaccine. Similarly for Morocco and Tunisia, and we need to support them in terms of finding the way to finance the introduction of the vaccine. Other challenges which is applied for the North African region and maybe also other Middle East region from our conversation like Jordan, Iraq, they are very willing to be engaged in the introduction of the vaccine, but they mention this main challenge is financing the national immunization program, HPV vaccine. In addition to the other challenge which has been mentioned by Dr. Khaled is the stigma, the perception of healthcare professional, perception of the community, and all these items of challenge we are now working on and addressing them in a different webinars or awareness campaign or forum. We need to focus on integrated communication campaign. We target parents, youth, and clinician because healthcare professional. There is a big move in that area, but it's still there is a lot of resistance from healthcare professional. We want to advocate for strengthening the supply chain and resilience. The issue of mentioned by colleague from WHO hesitancy in the vaccine, similar to other vaccinations. So this is one of the area which has been addressed by the civil society and need to be continued addressed by civil society and other partners. Data generation to track the uptake and the equity gaps is very important, and this is one of the area which we will continue working on it to generate data specific for the region. So we are welcoming all organization, individuals to be joining us in the fight against the HPV and to reach the target of HPV elimination. So you can join us on social media or to be updated regularly and visiting our website also. And I think I will stop here and will be happy to take any questions or comment from.
Thank you so much.
Thank you. Back to you, Balkiss.
Thank you so much, Dr. Ibtihal. It's been great to hear about the coalition advocacy strategies and next step towards progressing universal HPV vaccination in our region. Now, without further ado, I'll move to our partner organization, the co-host of this webinar, Chief Executive of Global Action on Men's Health, Peter Baker. The floor is yours to talk about the forthcoming activities of NOMAN and Global Action on Men's Health, as well as share the updated proposed policy brief on universal HPV vaccination.
Thank you very much indeed, Balkiss, and also a huge thank you to the MENA Coalition for organising this webinar jointly with us. So it's a great privilege to be working with you on this issue and advancing, talking about how we can advance universal HPV vaccination in the MENA region. I'll just say a few words. I know I'll be very brief because to leave time for questions to the panel, but I just want to say a few words about the advocacy work that we're doing at Global Action on Men's Health together with our partner organisation, NOMAN is an Island, Race to End HPV. Last year in 2024, we launched a global call for routine universal HPV vaccination. We want to see this introduced throughout the world. We think it is the best way of preventing all the diseases caused by HPV in both men and women. And we do think that the number of cancer cases in men caused by HPV around the world has been seriously underestimated. We think that the figure is at least 180,000 cancer cases a year in men. Of course, many more women are affected by cancer caused by HPV, but we also think that vaccinating boys and vaccinating men will accelerate the elimination of those cancers in women as well as men. So what are we up to? What are we doing? As I said, we've issued a global call for routine universal HPV vaccination, and we welcome all organisations concerned about this issue throughout the world to support our call for action. And if you want to find out more about that, please go to our dedicated website, endhpvglobal.org, and you can see the URL on the screen. We're putting together a position statement, an academic position statement on HPV routine universal vaccination, which we're finalising at the moment. I'm pleased to be able to tell you that Dr. Ibtihal is one of the co-authors of this statement, and we'll be submitting it for publication shortly to one of the Lancet publications, and hopefully that will be published in the first quarter of 2026. Could you just go back to the previous slide, please? We're also going to produce guidance, or we plan to produce guidance to support all countries, but focusing on their income levels. So we know there are different issues for different types of countries. So we're going to produce guidance targeted at low, middle, and high income countries on how they can make the move from girls only to routine universal vaccination. And we hope to do some of that work with the MENA Coalition. We'll be continuing our advocacy work, as I've said, and we'll also be continuing to host webinars on HPV vaccination. This is the 5th webinar this year we've organised, and we hope to organise at least 4 more next year. Next slide, please. So these are some of the organisations that have already endorsed our call to action. You can see that in fact, there are over 70. They're not all shown on this slide. And hopefully you'll see in there the logos of the MENA Coalition and the Qatar Cancer Society. So any other organisation that would like to join us and have their logo on this slide in the future, please contact us and let us know. And moving on to the next slide. Our next webinar, which is in January, is on men, cancer and HPV, advocating for HPV policy change. And that's on the 27th of January. We'll be looking at case studies of different and successful HPV advocacy campaigns which have changed policy. And we'll be, if you join our newsletter, and the details of that are in the chat, we'll be able to let you know how to register for that webinar. And finally, the next slide. I just want to acknowledge the organisations that support Global Action's work on men, cancer and HPV. We receive an unrestricted educational grant from MSD and also funding from NOMAN is an Island, Race to End HPV. So we're very grateful to those organisations for supporting our work on this important issue. I'll stop there and obviously, like the other panelists, very happy to answer any questions. Thank you.
Thank you so much, Peter, and thank you to all of our panelists today for their great interventions. We're really happy that we have this conversation today to advance the universal HPV vaccination in MENA, among other regions. So without further ado, we'll start taking questions from the audience, and we'll set like we go by 2 or by 4 questions according to the number of questions we have. I saw a great question in the chat already in the Q&A actually. So it's about setting the settings of the HPV vaccination implementation in dental clinics. So there is this question. I think Dr. Khaled, you can answer this one.
Yeah, thank you, Balkiss. Actually, it's as I said, it's provided for everybody, boys and girls in certain age, and also patient visiting any clinic if they came for the health center, unless the woman is pregnant. But we were discussing in the national level about oral screening, if we can do that, and we found many challenges because with the mouse flora and difficult to be done. But still, it's under discussion. We're looking for that, and specifically for patients that they have recurrent infection, something like that, so we can understand more what's happening to them. But this has been discussed. But more for cervical cancer, cervical screening is more established, as I can say that. But we are not only giving vaccine for a certain clinic, as I said, it's for everybody. But we're specifically targeting students in grade 8. They will receive their first injection, and when they become grade 9, they will receive the second injection. In grade 8, they will be less than 14 years, so they need only two doses of vaccine. So this is how we adopt it here in Qatar. Thank you.
Great. Thank you so much, Dr. Khaled. I see 2 more questions for Dr. Aarti. So first of all, do you think that the recent UN political declaration on NCDs, which says that HPV vaccination should be for both boys and girls, will lead to change in WHO position on universal HPV vaccination? The second question for you as well, Dr. Aarti, is WHO policy on routine universal vaccination. How can WHO do more to support expansion of vaccination to both boys and girls in the MENA region? The floor is yours, Dr. Aarti.
Yeah, thank you, Dr. Balkiss. But before going to my responding to my questions, I would also like to just add on to what Dr. Khaled mentioned about the dental clinics. We always have to, we all know that the 85% of the HPV cancers are related to cervical cancers. So whenever we are implementing a strategy, we have to trade off, and we have to also understand the cost effectiveness of the program, public health system. And so like a dental clinic, any clinic can be considered for vaccination, but then there are limitations. We prefer still there is a long way to go to initiate the vaccination in dental clinics another way. So that was the one thing. My question about the second question, the first question you just highlighted, right? How this declaration can affect. So definitely the HPV vaccine is entitled for both girls and boys, both the genders, but our primary target is the age group of the primary target is young girls. And we know that even the vaccination in the young girls between 12 to 13 years, it protects almost 87%. When as the age grows, the effectiveness goes down. So it's important to first, because it's a cervical cancer, we want to focus on girls. But definitely we cannot overrule the boys, but considering the cultural sensitivities, considering the funding constraints and other things, if all the factors are favorable, we can expand to the secondary target group, which is not only the boys, but also the elderly age group. But when we are talking about the women vaccine, like the young girls vaccination, it is important to prioritize the immunocompromised, irrespective of the male or the female. So this is the, I hope I answered the question. Definitely in future, when the vaccine availability is there, the funding constraints are not there, then this can be scaled up to boys as well as the elderly women. But right now, considering all the situations, we are focusing on the young girls, young women.
Thank you, Dr. Aarti. This is understandable. I'm moving on to next questions for Dr. Ibtihal. What awareness or discussion is there about the other cancers and diseases caused by HPV in the region, such as anal cancer, vaginal cancer, penile cancer, etc.? How is this addressed in the MENA region? Also, the same question that was addressed to Dr. Aarti for you as well, Dr. Ibtihal. Do you think that the recent UN political declaration on NCDs can influence WHO position on universal HPV vaccination? The floor is yours, Dr. Ibtihal.
Yeah, thank you for the questions. Yes, definitely what we are now doing is advocating that the HPV-related cancers. So one question I saw that how we are, addressing the issue of sociocultural stigma in our region related to vaccine. That is one question has been raised in the chat. So I think, most of the country in the GCC have addressed it as a cancer prevention. So the vaccination is not related to HPV as a sexually transmitted disease rather than a cancer prevention. And it is a great opportunity and a wonderful things to know that cancer can be prevented by using a vaccine. And this is the tool and the message which has been always promoted, and it is one of the key success of the vaccination program in country like Saudi Arabia, with the issue of conservative society, we could say, but it has been successful to introduce the vaccine using the relation between the vaccine and cancer. Similarly, similar to this message, people have to understand that HPV is not only cervical cancer, it is related to other male cancer. And this is what we do as a civil society, make the relation very visible and advocate for cancer prevention using the vaccine. For the question related to United Nations, what is the United Nations Political Declaration? It is an advocacy tool. It's a document, it's a political document coming out which make leader of the country accountable if it is endorsed. So it will be definitely move the agenda forward. If we want to move any agenda, we have to comes in a political declaration, and that is very positive key document for policymaker, for the advocate to move forward. But unfortunately, I have not a good news for you. It's still the document, it has been not endorsed yet, and it is with the president of the UNGA. So, and I'm calling here for all people who are joining us to listening to us to raise this issue with their country leaders, with the country counterpart, to move forward for endorsement of the document, because it is very vital for all organizations who are advocating for HPV vaccination is to have this document to make us have a strong advocacy and make country accountable for the action related to this agenda.
Thank you so much, Dr. Ibtihal.
Work my video. I don't know why.
It's okay. We can see your picture, which is also as beautiful as you are. Also, we have another question.
Please, if you allow me,
Yeah.
I just want to follow up on what Dr. Ibtihal said.
Yeah,
I think specifically in many of GCC countries, the best strategy to adopt that to relate the vaccine to the cancer itself, and this is actually what we have done here in Qatar. And we always say that we don't know the causes of cancer. Meaning what? Meaning all cancers, all cancer, we don't know the cause of it, but we know the predisposing factor: lack of physical activity, unhealthy nutrition, smoking, alcohol, etc., etc., etc. But the only cancer that we are pretty sure that that there is a direct causation between the effect and the outcome is about HPV infection and cervical cancer and oropharyngeal cancer. And this is how we adopted here, and this is how the government was saying when we were discussing in INTAC that the vaccine should be provided for boys and girls. It should not be because it's preventing cancer. We hope that we prevent all cancers, but here we have a direct effect that this vaccine will prevent cancer if it is cervical cancer or oropharyngeal cancer in men. So this is how we adopt it here in Qatar. Thank you.
You're on mute, Balkiss.
Sorry. I would like to thank you, Dr. Khaled, for your answer. I was almost going to ask you the same question that I asked Dr. Ibtihal. We also have one last question from the chat regarding the communication strategies used in our region. I think this was covered already by Dr. Ibtihal. There is specificity
Yes, I already
religion, the
addressed this
culture,
one.
etc.
Yes.
Yeah, so thank you so much for that question. I hope we covered everything. I would love to thank once again all of our speakers, all of the participants as well. We have over 50 attendees today, which is great. And before closing our webinar, I'd like to invite you to take a few moments to fill in the webinar evaluation form, which Tim has shared on the chat. So we have your feedback to have better future sessions. Thank you once again, and we look forward to continuing our joint efforts toward eliminating HPV related cancers in the MENA region.
Thank you.
Thank you. Thank you
all.
very much. Thank you.
Thanks, everyone.
Thank you, everyone.